group in Vancouver matched your funds so that we could go forward and do this. So, spasmodic dysphonia, as you heard earlier from Dr. Engel, is a neurological condition. It's actually a task-specific focal dystonia. So the problem is starting in the brain. It manifests in your vocal cords. And that's why the current treatments of paralyzing the muscles or cutting the nerves to the muscles work for the vast majority of people. But there are some people who it doesn't work for. The Botox stops working, or they don't like the up and down roller coaster of Botox. What are you going to do for those people? So Murray Morrison, my laryngologist, asked me, why can't you treat the underlying neurological condition and just let the muscles function normally? Well, that's a good idea, because that's exactly what we do for all the other kinds of dystonia. Generalized dystonia, cervical dystonia, musician's cramp, not blepharospasm as much, oromandibular dystonia. And we use a technique, a neurosurgical technique called deep brain stimulation, where we put a platinum electrode in the part of the brain that is malfunctioning, and we connect it to a pacemaker, and the pacemaker blocks that malfunction. It's actually a rhythm. You have a natural rhythm in your brain, and if you change to an abnormal rhythm, you can get spasmodic dysphonia, and the DBS will change you back to the normal rhythm. It treats the problem in the brain and allows your vocal cords to just function normally. So here's a young girl with generalized dystonia. And you can see, this is not spasmodic dysphonia, this is her whole body is affected. You can see her feet, her head is turned, cervical, you see the muscles on the back of her neck hurting her, she's pulled over, she's disfigured. And the treatment for generalized dystonia is deep brain stimulation. So this is her 3 months later. She has sold her wheelchair, and she actually got a job as a motivational speaker, and they made a movie about her. The movie is called Twisted, and it won an award at Sundance Festival, some movie festival in your country. And what's important is that it's a long-lasting effect. And so this is her, because no one leaves Vancouver. It's a beautiful city. This is her 15 years later, and one of my fellows who now does all the DBS in Mexico is going to turn off her stimulator, and the disease will catch her. The rhythm will switch back to the abnormal rhythm in her brain, and you can see it pulls her neck and her body very, very quickly. She does not like this. I ask you to turn the volume up just slightly because of the next... So she's a good sport about it. This is not benefiting her at all. She's just doing it for educational purposes so that I can teach. But as soon as the stimulator is turned on, the rhythm reverts to normal, and the muscles are allowed to function again. So if you can do that for very severe generalized dystonia, why can't you do it for spasmodic dysphonia? Okay, so we do an operation for essential tremor almost every day. This is a lady in her 70s. She has essential tremor, and her problem is she can't feed herself. So she's going to a nursing home because she can't feed herself. She has a deep brain stimulator in. We'll turn it on, it'll change the rhythm in that part of the brain and block her tremor. So now she can feed herself, she doesn't have to go to a nursing home. So for us, that is a routine operation every Tuesday. And over the last 20 years, we've done almost 200 patients. And what we did is we looked back at our database and correlated it with Murray's database of spasmodic dysphonia. Because very rarely, people with essential tremor also have spasmodic dysphonia, about 1 or 2% of the time. So when we look back, we found 2 people that I had already operated on that had essential tremor, had their surgery for essential tremor, but they also had spasmodic dysphonia. So we found those people and we asked them, and they said that their voice got better after surgery. And they said, I thought that was part of the deal. And I said, I didn't know you had spasmodic dysphonia. I'd never heard of the condition until about 5 years ago when Murray approached us. So this is a looking back study is kind of weak in the scientific world because there's a lot of potential complications on that. But it was the first hint that maybe DBS could improve spasmodic dysphonia in a retrospective study. Then in 2016, we met this lady, who was a 79-year-old lady with, again, with essential tremor, coming to have tremor fixed, but she also had SD, and Murray was been treating her SD for 2 years. So we asked her, we're going to operate on your tremor. Would it be okay if we record your voice as we go forward? We're not going to tell you whether the stimulator is on or off, but we're going to record it. And then we're going to turn the stimulator on and record you again and we'll compare it. So I hope this works. But this is her with the stimulator in but turned off.
This morning, a man and a woman were ambling along a 1 mile lane.
And this is her with the stimulator turned on.
Eat eggs every Easter.
I did it got cut short a little bit, but there is a tremendous benefit in her voice with the stimulator on. And now we had the second piece of evidence to suggest DBS might improve SD. We had a prospective study, a patient who was moving forward. It's a little stronger in the scientific community. You don't have to take notes. I've tried to put everything on our website, which is stopsd.com. So we used these 3 patients as justification to come to you and say, could we now do a study prospectively on people who just have SD? Not people who had essential tremor who were getting their surgery anyways, but just people who had SD. Could we operate on them? And this study is called Deep Brain Stimulation for Spasmodic Dysphonia. Now, every medical trial has to have a catchy name now. And so, I really stretched the acronym to get the PC. But he enjoyed communicating beautifully, and so I thought it was appropriate. Here is the study. 6 patients. They all had adductor, AD, where the vocal cords come together. AD, spasmodic dysphonia. They were all right-handed as well for another reason. And we tested them going forward. We randomized the therapy. They didn't know whether the therapy was on or off, so you can't feel your deep brain stimulator. You don't know that it's on. It doesn't tingle you. You have no idea. So now you can do studies where you randomize people and have the therapy on, but they don't know it. And the strength of that is in science. It removes the placebo effect, because you don't know whether it's on or off. And it also removes the bias, where you desperately want to tell your surgeon, oh, I feel better, I feel better. You don't know whether the stimulator is on or off, and it's very strong scientifically. And then our outcome, the most important outcome when you do a new surgery is to make sure it doesn't hurt anybody. So we wanted to do a safety and adverse effect, and also we wanted to study, did it change your quality of life? Did it make your life better? And I'd like to say it was sponsored by you guys. Thank you. Okay, so here's the study. 6 patients. We assess them. They have their surgery. And then we adjust the surgery, the stimulation, to maximize the benefit for them. Because everyone's SD is slightly different. Everybody needs slightly different amount of stimulation. And the beauty of the deep brain stimulator is that it's very adjustable. If you get too much stimulation and you get a little tingling, we can turn it down. If you don't have enough benefit, we can turn it up. If your disease ever changes, not so much for SD, but in Parkinson's where it's changing, we can chase your disease by turning it up as we go. So then you're randomized to either and you don't know whether the stimulator is on or off. So you have 3 months with the stimulator on and you're assessed, 3 months with it off and you're assessed, Or you're in the other stream, where you started with the stimulator off, and now you're switched to on. So it's a crossover, double-blinded, randomized. And then at 6 months, everybody knows that the stimulator is on. And we turn it on because we want to see, is it long-lasting and effective? How are you a year later? So the second half of the trial is, we call it open label. The patient knows that the stimulator is on. Okay, and so I have operated on all 6 patients. 5 are done. The 6th patient is still in the blinded phase, and no one's allowed to tell me how they're doing. And so I'm going to tell you a little bit about these 5 patients. So it's preliminary results. These results have not been published. So don't tell anybody. And we're waiting for this 6th patient to come through. He will be unblinded, and then we will publish the results. Our hope is in the Lancet or New England Journal. So what I can tell you is about the assessment of these 5 patients before surgery and when they were in the blinded phase, either with the DBS on or off. And here is the results. The quality of life, based on this voice handicap index of the 5 patients, was significantly different with the DBS on compared with the DBS off. In the scientific world, anything less than 0.05 is considered significant. So this is very significant. It's less than 0.001. When I show you statistics, it's hard to get a feel of what the results are. So I'd like to show you a video of one of my patients who has kindly agreed to allow her video to be shown in the lay public. All of our people have agreed that I'm allowed to show their videos to surgeons, but one of our patients said, I want to let the other people with SD know what it's like. So hopefully the sound will be good.
What is the sun height?
Slightly higher, yeah.
Rainbows in here.
24 hours before surgery.
They have like a prism and for a rainbow. The rainbow is the vision of white into many beautiful colors.
And this is
according to that
4 weeks after her surgery.
People look, but no one ever finds it. When a man looks for something beyond his reach, his friends say he's looking for the pot of gold at the end of the rainbow.
So it's not a crystal clear example because she's using lots of tricks to try and get her voice across. She's whispering to try and trick her vocal cords to get open. The important thing is it long lasting? So this is a video of her after 1 year of therapy. Now it's not blinded. She knows that the therapy is on. Here is her 1 year after the surgery. And I'm going to get you to read that last sentence with the stimulator on, and then I'm going to turn it off and ask you to read it again, okay? Well, here we go. Stimulator on, the last sentence.
When a man looks for something beyond his reach, his friends say he's looking for the pot of gold at the end of the rainbow.
So that is excellent. I'm going to reach over and just turn off your stimulator. Give it a chance. Have a few seconds to let the effect of the stimulator wear off. And I'll get you to read that sentence whenever you're ready.
When a man looks for something beyond his beyond his when a man looks for something beyond his reach, his friends say he's looking for the pot of gold at the end of the rainbow.
turn the stimulator back on. And you'll feel some tingling on the side of your face when the stimulator turns on, and then the tingling will completely fade away. Wait for it to fade away. And when you feel comfortable, read that last sentence again, please.
When a man looks for something beyond his reach, his friend said he's looking for the pot of gold at the end of the rainbow.
That was excellent. Yeah, thank you. So we think that this, when we finish, will be another piece of evidence suggesting that deep brain stimulation may be effective for spasmodic dysphonia. Because it is a randomized controlled trial, and RCTs are a very strong scientific argument towards an answer. Okay, well, what is next? Well, whenever you do a trial, you learn things as you go. I mean, I've never been in the room with so many people with SD, and I'm learning so much just meeting you all. We planned to initiate another trial. You can never prove that something is true with just one trial. You actually need 2 trials, and ideally you need someone else saying, yeah, I agree with you, it works. And so we are planning for a larger randomized controlled trial for adductor spasmodic dysphonia. The next thing is, deep brain stimulation does not care what muscle is involved. You saw the benefit in that young girl with dystonia in her foot or neck or body. So deep brain stimulation theoretically should not care whether it's the muscles abducting your vocal cords or the muscles adducting. It should block the pathological signal and allow your muscles to work normally. So we think that deep brain stimulation may be effective for abductor spasmodic dysphonia, and we plan on doing a trial on them. Much rarer, but maybe even more helpful because sometimes that's an even harder condition to treat. The beauty of deep brain stimulation and our duty to the disease is that we have patients with an electrode in their brain, and we can study their brain because they've had this surgery. So we have someone who has spasmodic dysphonia and a minute later doesn't have it. And we can see what is the difference in the way the brain is functioning. And we know that deep brain stimulation only works very close to the tip of the electrode. And therefore, we must be in a very important circuit for spasmodic dysphonia. And so we are teasing out what are the brain pathways for spasmodic dysphonia. Then we can present that information back to the basic researchers and say, would you focus on this area here because we think we know the pathway. Can you tell us what's wrong with the pathway? Eventually, they'll tell us what's wrong with the pathway, and they'll develop a medication or a treatment, and you won't need any surgery for your SD. They'll know the cause, and they'll just cure it. And so, ultimately, the goal would be that you don't need any surgery for your SD. But in order to get there, you need to actually understand the brain, not just the muscles that are being affected. And finally, and I put a question mark behind this, because there's very weak evidence. But there possibly, if you modulate the brain, you can push the brain back into the normal rhythm. Most of you in your 20s and 30s had a normal rhythm, and then it went over to spasmodic dysphonia. Can you modulate the brain back into its normal rhythm? And the reason we think this might be possible, and I underline might, is because of those patients that we operated on 14 years ago when we didn't know that they had SD. One of the patients I operated on, we went back, and he's one of the guys who said, oh, my voice got tremendously better after surgery. So we turned the stimulator off, and his voice continued to be normal. You saw that after a year of DBS, if you turn the stimulator off, her voice switches back to SD very quickly. But this gentleman had had DBS for 14 years, and his voice stayed normal once we turned the stimulator off. His rhythm had reverted to normal. So he had spasmodic dysphonia and essential tremor. So he couldn't feed himself. He didn't like having the stimulator off, and he couldn't work. So we paid him a week's salary to stay at home and not work, to see how long would the effect last before your SD. And at the end of 7 days, his voice was still normal. And so he wouldn't allow us to keep the stimulator off any longer than that because it was just horrible not being able to feed himself. You saw an example of the lady. That's how bad his tremor was. But 14 years of DBS produced at least a complete week of absolutely normal voice with no stimulation at all. So we honestly don't know how long he would go. But the suggestion is we sometimes see this in other forms of dystonia. After long-term DBS, their dystonia reverts back to normal. We think it's a rhythm change in the brain. So everything I wrote is on our website. You can have a look at stopsd.com, and I would just say it really is a thrill and honor to speak to you today. Thank you very much.